Do you know that a clinical trial held in Spain has shown that among the nearly 200 patients treated with biomagnetic pair therapy, patients with such diseases as cancer, hepatitis, arthritis, fibromyalgia, renal failure, epilepsy, dermatitis, among many others, 66% of these patients were totally cured and only 4% did not show any improvement. That is, 96% of the patients that were treated with biomagnetic pair therapy were cured or had their condition improved. These are the facts, and they can easily be checked. Do you know that official authorities do not show any interest in having these facts disclosed and in further researching? However, it would just take a few days and it would cost pennies for the authorities to make an official clinical trial with just a few hundred patients suffering from several severe conditions like cancer, AIDS, diabetes, Parkinson's, rheumatoid arthritis, multiple sclerosis, osteoporosis, lupus, psoriasis, hepatitis, gastritis, irritable colon, diverticula, prostatitis, emphysema, glaucoma, varicose veins, and so many more. It would be so easy and fast to test the efficiency of this therapy and validate officially the results. That would cost pennies. Biomagnetism practitioners are open to collaborate with the authorities. We publicly express here through this presentation our request to cooperate with health authorities which are involved in guaranteeing public health. Do you know that mortality rates in underdeveloped countries due to the four biggest pandemias, which are tuberculosis, malaria, AIDS, and leprosy, could be drastically lower today if this therapy was applied in those countries? The authorities could at least just test initially with a few hundred patients. Why don't they do it? Do you know that the World Health Organization refused to publicly endorse and support the biomagnetic pair therapy because they said that medicine has to cost money firstly, that is to produce benefits, and only secondly to cure. But biomagnetism does not sell drugs or products to consume and make business. The organization could easily deny this just by performing a test with 100 patients treated with biomagnetism and see the results. Why don't they perform such a low-cost trial? Do you know, however, that a few Latin American countries, where the influence of big pharma corporations is not so strong, have already started to support the biomagnetic pair therapy, and their governments have decided to include it in their public health systems and their university departments due to its outstanding curative and preventive success? These are the facts, and they can easily be checked. You may want to watch the video that was filmed in Spain during that impressive clinical trial previously mentioned that shows the spectacular effects of the biomagnetic pair therapy in dramatically improving the quality and mobility of red blood cells, increasing blood circulation, cleaning the blood from bacteria, fungi, and impurities, activating neutrophils, balancing acidosis, and other highly beneficial effects. These are the facts. They can easily be checked by anybody, especially by public health institutions. Authorities should never censor nor stop anything before proving its inaccuracy. We therefore invite authorities to check these facts by themselves.